Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande from Pune City, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. My dear friends, as you know that I am MD, Doctor of Medicine in Ayurvedic Medicine, that is Kaya Chikitsa, yes, and Ayurvedic Physiology also, that is double post-graduation. I have the team of the doctors and you can definitely take the advantage. For paid online consultation, you can WhatsApp me on 9226810630. The number is in the description also. So, my dear friends, we are making the series Ayurveda in General Medical Practice, that is Ayurveda in GP. And today's our discussion topic is hemiplegia, that is the paralysis of one side of the body. I think this is something not good disease because whenever the person gets, of course, it is not totally under your control, but yes, you can try to avoid this particular disease as far as possible, because otherwise it will make you the dependency to the other people, and that is like a very heavy burden to your family members, economically, physically, mentally, emotionally. So what is the basic requisite? Try to avoid this particular disease as much as possible. So you will say, sir, how we can avoid it? Because it is happens. I don't know, my dear friend, there are, we are discussing the causes, investigations and treatment, but there are some causes which definitely can, you can take by yourself precaution. Actually, according to Ayurveda, this is the vata problem. Vata disease is there because vata is responsible for my these movements, hand and legs movements are because of the vata dosha. And whenever your brain is getting problem, then this nervous system is getting affected. So this is a neurological problem. According to Ayurveda, Vata, Pitta, Kapha, these are the bioenergies, and Vata bioenergy is basically regularizing the musculoskeletal movements and the brain and nervous system activities. Now, when this nervous system word we hear, then it is very, what you can say, the little bit seems to be more complicated, and especially the medical students, they are afraid of the nervous system examination. But my dear friends, in Ayurveda Academy YouTube channel, Ayurveda Academy 19 is my handle name. So if you go there and see the clinical examination videos, you will see the fantastic 3 small videos of nervous system examination. Please check those videos, and that are very, very useful. Even Ayurveda Academy is a name of the mobile app created by Professor Deshpande. It is available on Google Play Store, and you can freely download that, and there are 10 programs, any program you can purchase. Now coming back to the our vata dosha problem. So the first thing to avoid this problem, you just take care of your vata dosha in the body. Vata dosha prakopak ahar vihar, the patient should avoid. The vata is a dry, vata is a cold, vata is a mobile, chala, ruksha, these are the properties. So if you are taking your food, stale food, always taking the chips and what you can say, the food without milk, food without ghee, food without what you can say, the water and beverages, buttermilk, fruit juices, nothing, only dry, dry, dry. Then that makes your body whole dry, and that can be the problem for your nerves also. So be careful. Then keeping late at night, that means going to the bed very late, that also makes the vata prakop. If you have the constipation tendency, you have to check it out. And the most important, I am telling you to begin with, 3 very important causes that will make the hemiplegia. Number 1, thrombosis here. In the arteries, there is a blood clot that is called as a thrombosis. And because of the thrombosis, there is a brain attack. Like we get the heart attack because there is a blockage in the coronary arteries. Similarly, in the cerebral arteries, if you get the blood clot, there is also ischemia and infarct in the brain cells. And that is why, because all our, like it is like electricity, all the actions, our hands and legs are moving, but the brain has a important controlling centers. It receives the senses and it is giving the orders to the hands and legs to work accordingly. So all sensory and motor organ centers are in the brain. Okay, so brain is a very important organ. That's why we must wear the helmet to protect our head from the accidents and all these things, because there you get a hemorrhage in the brain, and brain hemorrhage is also very important cause of the hemiplegia. Remember my words. So thrombosis is first cause. Embolism. What is embolism, sir? It is a moving blood clot. Thrombosis is a stable blood clot, and embolism is a moving blood clot. and hemorrhage is a bleeding. So bleeding in the brain. So these are the three important causes. If bleeding in the brain is a massive, the patient will die immediately within a 24 hours. But if it is a less, then there is a residual damage, then you get the paralysis attacks. Similarly, with the thrombosis and embolism happens, my dear friends, why the brain bleeding? What is the commonest cause? That is uncontrolled hypertension. Remember my words. So those who are having the blood pressure, they should regularize, check the blood pressure. There should not be miss of any single tablet of the antihypertensive medicine, because missing your single tablet can cause the bleeding in the brain. So be careful. Okay. So hypertension is a major cause. Then avoid the fatty foods, avoid your cholesterol, dyslipidemia, obesity, smoking. These are all alcohol. All these are the contributing factors which can cause damage to your brain cells, and you will get the brain attack or the hemiplegia. Okay. Then there are very rare causes, like for example, maybe brain tumor may be there. So let us check what are the other causes. Now, according to Ayurveda, whenever after the, because for the hemiplegia, I will suggest you there are two things. One is little bit weakness of the hands, little bit weakness of the legs. Immediately admit the patient to the hospital and do the MRI of the brain, because then can save the further gross damage to your hands and legs. First 4 hours are in the heart attack or in the brain attack. First 4 hours are called as a golden hours, because in that, if the patient receives anti-blood clotting injection, which is called as an injection streptokinase or urokinase, then there will be dissolving of that blood clot, and yes, the patient can save the total paralysis, and that is the best thing possible. So first 4 hours is very essential, but then after 24, 48, 72 hours after they give the discharge, doctors say now this is a neurological problem, so there may be automatic recovery till further 6 months. So go take the patient to your home, do some physiotherapy and all these things. But in that case, I will suggest immediately go to the Ayurvedic Vaidya and take the Ayurvedic treatment definitely as an adjuvant or supportive or nourishing treatment. Because Ayurvedic massages, Ayurvedic Shirodhara, Ayurvedic Nasya treatment, Ayurvedic Basti treatment, medicated enema, number one. And even Ayurveda's Charak Siddhanta, don't forget, Charak is saying that Paksha Ghate Virechanam. Remember this principle, Paksha, there is always laxative chikitsa or purgative chikitsa is given. There are some different reasons, scientific reasons are there. I am not bothering you by giving the too much scientific explanation. Now we will directly come to the causes, investigations, and treatment of paralysis. Hey, why Hemi? Hemi means half of your body. Remember, whenever your right leg and right hand is not working, the problem is on the left side of the brain. That is called as a contralateral. If your left hand and left leg is damaged, then the problem was here in the right side. So there is an opposite. Right problem, then damage is on the left side. Left problem, the damage is on the right side. That is called as a contralateral damage. Okay. So here the problem is called as a cerebrovascular accidents. Sudden onset. Now see, vascular causes like hemorrhage that I have discussed, rupture of the arteriosclerotic vessel, acute infections like toxic agents, trauma without helmet, angiomatous malformation, tumor, cancer tumor or other, blood dyscrasias like your bleeding time, clotting time not proper, platelets are less and bleeding tendencies are there, various systemic diseases. Then thrombosis, arteriosclerosis because of the fat deposition, cholesterol, high cholesterol, arteritis of the small blood vessels due to syphilis, that is the ulcer on the penis, and it is a what you say, the sexual transmitted disease, that is STD, visiting to the prostitutes and sex social workers. Then polyarteritis nodosa, disseminated lupus erythematosus, venous thrombosis, that is cortical thrombophlebitis. Simple thrombosis and embolism. You just forget about all remaining things, but embolism. Commonest cause is the detachment of a fragment of thrombus lying in the arterial appendage or in the left atrium in a patient of auricular fibrillation. So whenever heart problem occurs, there is a possibility that after heart problem, the patient get the paralysis. Okay. Then mural thrombosis from the cardiac infarct, that is heart attack. then vegetation in subacute bacterial endocarditis, inflammation to the heart muscles, cardiac surgery or operations in the neck or the thorax, air embolism following the injury to the lungs. Intracranial infections like encephalitis and meningitis. Meningitis is very common. Even tubercular meningitis in the adult is also very common. So take care whether the problem is related with the meningitis. Trauma, depressed fracture over here, hypertensive encephalitis, post-epileptic paralysis, disseminated sclerosis, uremia, and hysterical. Slow onset for years together. First, it was very weakness, then tingling numbness was there, and last 1 year, the patient was complaining something about the weakness of the limbs, hands and legs. Then there may be cerebral tumor, cerebral abscess, or internal carotid artery occlusion, chronic subdural hematoma, blood clot, meningitis, encephalitis, chorea, general paralysis of insane, congenital defects like diffuse sclerosis, cerebral and agenesis. Now, what we can do? Doctors do the CSF examination. Here we have the fluid, cerebrospinal fluid examination to rule out the intracranial causes. X-ray, you have to do the X-ray of cervical spine, also the skull and the chest. ECG for the myocardial infarction, heart attack or cardiac arrhythmia. Hemogram and ESR to rule out the acute or chronic infection, because WBCs are the soldiers. When there is a normal count is 4 to 11,000 per cubic mm, if that count, white blood cell count is increased, it indicates the infection. Then urine routine, again to check the infections, or blood sugar level to rule out the diabetes. Renal function test, that is urea and creatinine, to sort out or to rule out the kidney problem. Now the treatment. Arrange for the ambulance and shift the patient to a nearest hospital, because 4 hours are the golden hours. Investigations at proper time can diagnose, and it will improve the prognosis. Prognosis is sadhya sadhyatva. The patient can be better cured or better taken care of. If patient is conscious and well oriented, give sarpagandha churna 1 gram stat with the ghee. After acute condition and proper investigations and management is done, general practitioner can choose from the following: gentle scientific massage of the patient with Mahanarayana or Shatapaki Balatail or Shatavari Siddhatail, followed by the Avagaha Sweda. Then Dashamula Siddhakshira Basti. Basti is a medicated enemata with Narayan Tail. Or you can give the best tablet, Brihat Vata Chintamani, 1 tablet 1 or 2 times in a day with milk or with the honey like a pest. Then you can give the Mahayogaraja Gugulu, 2 tablets 3 times in a day, Arogyavardhini, to take care of the metabolic processes, 2 tablets 3 times in a day for 1 month minimum. Another prescription, tablet gold compound, Ayurveda Sishala Pune, 1 tablet once in a day with milk. Tapyadi Loha, that gives the strengthening to the neurons, 250 milligram. Then Shranga Basma, 250 milligram. Ekanga Virarasa, very specific tablet for Pakshaghat in Ayurveda, that is Ekanga Vir. Ekanga means half, 125 milligram 3 times in a day. Another prescription, Sutta Shekhar, because there may be hypertension, 125 milligram. Tapyaji Roha 50 milligram. Shranga Basma 25 milligram. Sitopaladi Churna 750 milligram. Mixed together 3 times in a day. Or also you can use the Mahavata with Vamsana, 2 tablets 3 times in a day with ginger juice and honey. Raupya Vasma 30 to 50 milligram with honey 2 times in a day with Maharasnadi Kvath 4 teaspoons with equal amount of water. Trailokya Chintamani Rasa, very interesting, from Baidyanath company, especially Suvarna Moktik Yukta, 1 tablet 2 times in a day. Avoid the exertion, both physical and mental. Watch for the regular bowel movements. Your stools should be normal. Regular and high calorie diet as per the digestion. Use of the castor oil in the chapati is outside visible. But as I have mentioned, the massage, basti, nasya, abhyanga, all these management are very, very helping as a Ayurvedic physiotherapy to this particular patient. So my dear friend, this is all about a short discussion about the hemiplegia. And I hope you have liked. Please don't forget to share it and also subscribe my YouTube channel for giving the encouragement of Professor Deshpande's genuine efforts to give the scientific but lucid language. Thank you very much. Take care. And I see you soon in the next video. Thank you very much.